Guys, it's Dr. Emer in West Hollywood, and we have one of our VIP patients here today who's getting TCA cross for acne scars. We have to treat these types of scars, these deeper ice pick scars, with a different method. And this method includes putting a chemical right into the base of that scar, and a frosting will occur. He'll feel some warmth on the skin, but it shouldn't be too horrendous. And as that warmth occurs, you'll see a frosting effect. Now, some of the ones that he has are actually, if you move the skin, if you stretch it, they improve. These are not ice pick scars, okay? But if you stretch it and they don't improve, those are ice pick scars. So for example, that one right there that I treated is an ice pick scar, but you see how here these stretch and they're fine? Those need filler and laser, or lifting of the skin. So you see that frosting already occurring. That's doing great. And with the right type of skincare, we're gonna get an even better improvement. Now after this treatment, it's very important that skincare is adhered to. Now sometimes what we'll do is we'll paint on some TCA kind of around the edge of the scar to soften the edge of those scars. And that helps as well. I used to do this for years, and then Devin Lim decided to call it TCA paint. So a lot of people are calling it that now. He's basically doing great. So now we're gonna switch to the sides, turn your head all the way to the left. Perfect, and we're gonna go over here. We're gonna identify those specific ones. And our goal is to do a lightening peel on him, get his skin prepared. So a lot of this discoloration that's here will improve even in one treatment. Given his ethnic background, this is what can happen to the skin over time, genetics and sun. And so what we'll do this lightening peel on him, and then in about 2 weeks, we'll start the microneedling radiofrequency treatments and maybe a little bit of filler and more TCA cross if needed. He doesn't need much of the TCA cross. You can see how quickly he's frosting. That means his skin's very healthy, that it's already kind of exfoliated. Just gonna do a little painting effect on some of these deeper scars. Any questions or comments from the social?
What do you combine this with?
Well, today we're going to combine it. We did first a salt facial, which exfoliated his skin and got it prepared for what's to come next with the lightening peel. Turn a little this way. Now, unbelievably, he almost has no pores. Candace, did you have to extract a lot of pores?
Nope.
Wow.
There was like one spot.
Very minimal pores. Just painting a little along some of these scars here. But this is a good starting point for him because he hasn't done that much. We don't want to scare him with treatment. So we're going to start with a facial, which is what we did, the salt facial that prepared the skin. Now we're just going to do some light TCA cross and TCA paint. And then we're going to go into, in 2 weeks or so, we're going to start the microneedling radiofrequency treatments and maybe some filler to give him some improvement in the texture of his skin so it starts to smoothen out. And you can see here he's almost no pores, but some of those bigger pores, we're just going to do a little TCA cross, turn a little bit there. Perfect. So this one doesn't stretch, so we can do a little bit more there. Kind of get an even frost, but with his type 4 or 5 skin type, what's going to be really important? Skincare and sun protection. Just to make sure he doesn't get any hyperpigmentation. We're going to go right into some of these little pores here. And this can be done on all skin types, but it just needs to be done very cautiously. So that's really it. That's the TCA cross for first treatment. And we're going to go to our next step, which is doing the Cosmetic peel. Stay tuned.